You did test positive, you've quarantined, you feel fine, it's been at least 14 days. Is there a test you should or could take? What should you do?
Right. Being in a healthcare environment, the CDC has produced specific guidelines for how healthcare workers should go back to work. And I think in general, they really do apply across a variety of professions and ways to integrate back into society. And their guidelines are that once you're 10 days past your first infection, or first symptoms, once you're 10 days past your first symptoms, and when you are 3 days without symptoms, then in general, you're probably okay to go back to work. If you were tested positive at any point in time, then they recommend that you test negative 2 times within a 24-hour, or at least 24 hours in between those 2 tests, to be able to return to work, and also not have any symptoms, obviously.
So what kind of test, because we hear a lot, right? Like the rapid tests, maybe not so good. There's a Siemens, there's a Roche, it's getting to be like a designer thing almost. What kind of test, do you think is the most reliable? What would you suggest?
Right. So in most cases, the availability of the laboratory test is what you would see if you go to a CVS or a Walgreens or a local testing site or a drive-through testing site that the city or county provides. And in general, those are good places to go. And those are doing the nasal pharyngeal swabs or nasal swabs that test for the virus itself. So we're doing the qPCR nasal pharyngeal test to assess whether or not you have virus still present in your body. Antibody tests are not recommended at this point in time, because what an antibody test will tell you is whether you've ever been sick with COVID. And in reality, that could have been several months ago, and you test positive. Whereas if you were just recently sick and you took an antibody test, there's even a chance that you may not show your antibodies, or it wouldn't turn up positive at that point in time. So you want the qPCR test, you want the nasal pharyngeal swab test if you're going to be tested as a return to work or a return to public settings type of application.
Okay. So, and you recommend 2 of those within a period of time?
So the CDC recommends that you take, once you're symptom-free, that you take 2 tests that have to be at least a day apart to verify that you are virus negative. Now, many will say, and it's definitely still a challenge for some people to get testing still in the community. While testing has increased, there's still, depending on where you are, potential to run an alliance. And so that's why there's a symptoms-based approach as well. Whereas if you're, again, 10 days post seeing your first symptoms and 3 days post your last detection of a fever or respiratory condition, then you're safe to go back. But if you can get a test, and better yet 2, that would be great.
Well, and we're also hearing, as you may well have as well, I mean, there are people who tested positive, really don't have any symptoms, but they've self-quarantined for 14 days or beyond that, and they've gone back to get retested, but the test still shows they're positive.
Yeah, it's an interesting phenomenon. We're still trying to figure out what that means as well.
Mm-hmm.
And so in those cases, it's thought that the virus may not be as infectious or may not be contagious at that point in time. And so a lot of companies and a lot of healthcare settings are reverting back to the symptomology, the symptoms part of the equation. Whereas if you're symptom-free for 3 days after that quarantine period, then you're safe to return back to work.
Okay.
There has not been many reports of people becoming sick, or as I'm aware of, there are not any reports of people becoming sick during this protracted virus carriage time, where we see people weeks after becoming better, that they seem to be still carrying the virus. Scientists are still looking into what this necessarily means, but it doesn't seem that they're contagious at this time.
Okay, well, that's a bit of good news, yeah? Oh, and I guess even if you have the antibodies, often we think that, at least with other illnesses, oh, well, that's good. That means I am protected and I can't spread the disease anymore. But we don't know that to be true.
No, that's absolutely correct. So if you take an antibody test and the antibody test is positive, we don't know that that means that you're protective, that you're protected. The idea is that you can make antibodies to all portions of the virus, but there's only specific regions of the virus that would block it from being able to infect you. And there's specific, what we call neutralizing antibody tests that are starting to become available that can test for those specific antibodies, but those aren't widely available at this time. And so until they are, we can't just say that because you have antibodies, you're protected.
Okay. If you have a quote clean bill of health, is there anything that would be wise to, I mean, should you bring that little document and show it to the boss, or?
Yeah, so each workplace will have its own guidelines and recommendations. Mm-hmm. Some may not require testing at all, but what you should definitely do is wear a mask. And the idea there is that even if you do happen to be carrying a virus after you feel well, and scientists still haven't figured out exactly whether or not that you're contagious or not, it's the best practice to make sure that those around you are protected.
A colleague of yours is saying, we understand today that he is fearful we may have to go back to shutting down again here in Houston, Texas.
Right. So Dr. Hotez is obviously very visible in the community and is a national expert on emerging infectious diseases, including COVID. And I think what he's reflecting on is the fact that we're seeing cases spike above where we even saw them in March and April. And we saw the effect that shelter staying in place, closing down businesses, and practicing self-isolation or social distancing, what an effect it had on the Houston community in terms of viruses going down, virus carriage and prevalence going down. Given how quickly it's rising right now and the potential threat to the healthcare system, particularly in the context of ICU beds and hospitalizations, it may make sense to go back to a period of time, a shorter period of time, hopefully, where we do need to take a step back and reopen.
Has there been any impact on like the flu cases we've seen because we've been good about COVID?
No, I think that's anecdotally, I think I could say that in general, the prevalence of other viruses seems to be diminished a bit during this period of time. And I think the social distancing and mask wearing practices that we're using to try to prevent the spread of COVID is actually spreading other diseases, preventing the spread of other diseases as well. I think it's going to be very important for everybody, and Dr. Hotez echoes this elsewhere too, but I think it's very important that everybody gets their flu shot when the time comes, because the healthcare system is going to be have their hands full already with COVID. Having patients coming in with flu is just going to challenge the system even more. And it also, at times when testing could become overwhelmed at those periods of time, or laboratories can become overwhelmed at those periods of time. Being able to distinguish a person who has the flu from a person who has COVID may become difficult depending on what the symptomology tends to be at that point in time.
You know, even when we have a vaccine, just like with the flu, right, we sort of anticipate what will be the prevalent strain, their mutations, all that sort of thing. We want a vaccine, but is it a bit of a panacea to think that once that first vaccine comes out, we're kind of good to go?
Yeah, no, I think there's reason for moderating optimism a little bit when it comes to the vaccine. Yes, the vaccine will be, if it works, a vaccine obviously will be very helpful. But whereas for the flu, we're interested specifically in being able to address the strain that comes out every year, as you alluded to. And currently for COVID, I think while that will be on the minds of doctors and researchers who are putting the vaccines together, another element of this seems to be the diversity in immune responses we're seeing amongst individuals to the virus itself. So there may be a vaccine that works really well on one individual, it doesn't work very well on another. That's the case with all vaccines, but it may be particularly an issue with COVID, given how really different the types of immune responses that we've seen so far. So it may take more than one vaccine to truly get to protect much of the population. And we'll see how that goes.
Yeah, it is interesting, the wide variation. Just as an anecdotal deal, I have a friend whose 85-year-old father got COVID, and he's been asymptomatic and he's felt fine.
That's awesome.
Yeah.
Yeah.
But, you know, how odd is that, right?
No, exactly.
You know.
And the one little anecdotal side of that
Uh-huh.
too, it may not be even the immune response that you may think, well, he must have a really robust immune response.
Mhm.
But the other side of the coin is just that we're seeing in asymptomatic individuals, they don't have as many antibodies, it seems. And so it may be
Huh.
more of a receptor recognition side of things, that the binding site on the person, so
Huh.
the ACE2 receptor but the receptor on the human is different in individuals. And so some of those modifications or some of those differences may lead the virus to bind those cells less efficiently, causing the virus not to be able to infect that person. So we're still trying to understand the host genetics associated with susceptibility and disease progression. And hopefully we'll be able to, at the end, you'd be able to profile someone and say, you're at higher risk for COVID than others. We already know that there's comorbidities associated with certain conditions, but at the genetic level, we should be able to determine that as well over time when we get some time to look at it.
That's fascinating. It's a bit ironic then, the idea that somebody who doesn't have a particularly strong antibody system may be more, I don't know if resistance is the right word, but susceptible
Right,
to
right,
COVID.
right. Exactly. It doesn't. I mean, they may not have a weak immune system. It's just their immune system doesn't play. They may have just as strong an immune system as somebody who gets profoundly sick. It's just that the receptors, the door was locked.
Yeah. A good way to put it. Is it possible to have like these super spreaders who are contagious, but they themselves have no, you know, they don't show any antibodies, they don't show any, I mean.
Yeah, no, that's very true. And in fact, that's why contact tracing is so important. It's something, another area of this disease control that the U.S. is going to need to come to grips with at some point. As we start to trace back and do the molecular or sort of the sleuthing to try to get back to who is spreading the disease and where and how did this person catch it and where did this person go. The asymptomatic spreaders are a potential threat because they're walking around, they don't feel sick, they're not going to get tested unless there's a other outside reason for them to do so, and they wouldn't be identified as a potential source of infection unless there's some sort of contact tracing mechanism in place. And those individuals, they may come into contact with dozens or hundreds of people on a daily basis, and so the potential for spread is scary.
Could they be theoretically contagious like for the rest of their life?
No, I mean, eventually, that's a good question. The virus eventually, your combination of the immune system and your immune system mainly will eventually fight off these infections that tend to not provide you any disease. It shouldn't stay with you for the rest of your life. Although we don't know the details of how long a virus lasts in an asymptomatic individual who's not being treated. It wouldn't be a lifetime, but there's a chance. We don't know, I guess is the best answer.
But it could be it could be more than 14 days or several weeks or something. Ouch. Okay. Right. Sorry. Anything else, sir, you'd like to add?
No, and it came up in that question, actually. I think contact tracing, I think, and this may not be suitable for news, but I think our aversion to people's aversion to wearing masks and for contact tracing, even at a basic level, just trying to identify people that you've been around, people that have been sick have been around. I think that's going to be really important for us going forward to be able to stem the spread of disease, especially in areas where the surges are quite dramatic. So Texas, Arizona, Florida in particular. So hopefully it doesn't get to the point where we're like New York, or we're like New York.
Sure. Well, okay, as you brought that up, right? So some of Google and some of the folks are introducing, put these apps on the phone, and we know that Taiwan has been extremely successful with its contact tracing, and it's, it does the whole phone thing. Yeah. You would recommend it?
Yes, and so I know in the U.S. in particular, we were very cautious about the types of exposure we give Big Brother or governments in terms of being able to be traced where we were. Especially as we use digital contact tracing, I think there are questions that need to be asked of the companies that are providing the services, but there's, as we've seen elsewhere, there's nothing more effective in reducing spread of disease when those types of systems are in place. And so I think it's, I think it's one of the key questions in our business world today and in our society is, can we develop tracing apps that people can feel comfortable using, are readily adoptable, and are effective.
I think the last time I checked, Taiwan had 7 COVID deaths.
It's amazing. It's amazing. And in South Korea, who had a lot of the disease, but or a lot of sickness, the contact tracing shut down some really spectacularly dangerous events. Like they had identified one person who went to 10 or 20 different clubs in a single night.
Yes.
Because of contact tracing, they shut down the spread of disease right there. I think that's the most dramatic case I've seen.
Dr. Joseph Petrosino. Thank you, sir. Bye-bye.
Bye-bye.